Hello and welcome again to another version of Pearls of Wisdom. My name is Leonard, President and CEO of Delta Dental of Massachusetts, and I'm really happy today to have with me Dr. Sean Boynes, and I want to get your title right, Sean, Executive Director of Person-Centered Care for the DentaQuest Partnership for Oral Health Assessment. That's critical. And do not adjust your TV sets. That is blue hair. It is nice to know that dentists can be fun people. I love it. I wish I could pull it off. I can't. But actually, we're here today to talk about a subject that I think a lot of people are interested in, and that is so many different products are out there now, related consumer products, especially around oral health and dentistry. And Sean, you're going to help us navigate through that that mire of all these products. And it seems like every day we're seeing more and more of these products come out. But first of all, what are some of the most common questions around products that you're seeing in your practice now?
Sure. I think one of the big things that continue to come around is the charcoal toothpastes. A lot of this has been popularized because there's folks on social media that are selling it as part of a cosmetic blend of different things. And really there's not sufficient evidence that says that charcoal toothpaste is actually beneficial. And
by the way, it sounds like the last thing I would want to put in my mouth is charcoal.
Right. I mean, if you think about it, really the design behind it is the same thing as the filters that most of us have in our refrigerators to catch all the bad stuff as it comes in. One of the other downsides, besides just not feeling like that's something you want in your mouth, is it tends to be very abrasive to the teeth. And so it actually takes some layers of the enamel off. And so for those that may have sensitivity, this can help increase that and also may cause damage down the road.
So we see new products coming up pretty much every day. What are some of the products or trends that concern you?
So another trend that we see is oil pulling, which actually dates back 3,000 to 5,000 years ago in India, which is really taking sunflower or sesame oil and pulling it between your teeth for 10 to 20 minutes. Now the idea is that it will be able to catch some bacteria and help make the mouth healthier. Where a lot of people are using it is they believe it helps to whiten teeth. There's really not sufficient evidence yet that it really demonstrates to make your smile brighter. There is some evidence, just a couple of studies right now, that show it may be beneficial for gingivitis. One study in particular was comparing that with chlorhexidine, which is a very popular prescription agent that dentists may use to help alleviate periodontal and gingival disease. For there, it seems like there might be some promise. Overall, we do not see any harm in utilizing it, but its benefits we're just not 100% sure on.
Right. Sean, one of the things that I think a lot of people, when they see something on TV or a friend talks about something, people in my family have raved about now these CBD oils. And a big question for most people, whether it's that or oral health products, is where do I go to get the right information so I know exactly what I should or should be doing? And talk a little bit about the provider role in that as well.
So the provider should always be in the mindset of how do I make my patient or the person coming to see me more knowledgeable in oral health. And so one way to do that is to always direct them to either Delta Dental's site or the DentaQuest Partnership site, where we have a lot of information and frequently asked questions. There's also the American Dental Association seal, which designates that there is a approval from the American Dental Association to a particular product, that it's been evaluated by the American Dental Association and that they're putting their name on top of it. On top of that, the American Dental Association does have a frequently asked questions section, which can help guide providers in specific issues where things come up within their patients or their population they serve.
So the ADA website seems to be the first place to go. Also, talk about social media. So many people today derive all of their information from social media. Is that a good place to go? What are some of the pros and cons for anyone that says, I'll just go to social media and see what my friends think or see what's out there?
Well, there's just as much good information on social media as there is bad, and so it does make it difficult for individuals to go and say, what am I seeing and what am I not? This is where the provider can help. They can start utilizing their Facebook page, their Instagram page, their Twitter to actually communicate with their patients or the people that are following them, and put in information that they feel is sound from valued and dependable resources, as opposed to what may happen sometimes is somebody just sees a post that someone else has put up and there's really no vetting or an understanding behind it. So if the providers can lead in the social media aspect, I think it's a great opportunity.
I agree with you. And obviously the providers are struggling in a sense that the amount of time to give to care, fitting yet another thing in, is a difficult. Can you talk a little bit about how challenging that might be to a provider who says, I've got this limited time, now you're asking me to do something else? Is it feasible to expect a provider to, in addition to providing everything he or she does, to now add that to the list of many things?
So I'm going to let you in on a secret. I overview our social media, but there is somebody who is going to take care of that for us. So my advice is to always say, who is the person who is the most social media savvy, who understands communications on your team, and let them be able to move it forward. There are providers who like to be the stars of social media, and that's fine as well.
We're looking at one right now.
Depends on who you ask. But yeah, I mean, I think trying to understand how you can get more involved in that atmosphere is going to be very important, especially as we're seeing a changing patient dynamic where we have younger people coming in and that's how they're preferring to get their information. If you're not part of that, you're going to end up missing the boat.
And we did have a session last time, and I would let people know that they should go back and look at that, where we did talk about how a practice can use social media effectively, and there were some great tips on that one as well. Dr. Boynes, we're so happy that you could come and join us. We appreciate it. And for all of you out there, if you have any questions or suggestions about not only what we talked about today, but anything in the future that you'd like us to see covered on Pearls of Wisdom, please leave a comment and we'll be glad to follow up. Thank you again and have a great day.